Ladies and gentlemen, you are welcome to this presentation on mental health question time, which is from a panel team. I'm Dr. Prosper Tettey Doe of the Healing Christian Center, and we'll be covering various topics in this presentation. Questions ranging from what is the Bible's view on demonic possession and mental health? 2, can we become possessed by demons and without realizing this could be the cause of mental health problems such as depression or anxiety? 3, how do you tell the difference between spirits and poor mental health? Example, schizophrenia and possession. 4, where does the mind end and the soul begin? What is the relationship between the two? 5, do mind-altering medications affect our soul or spirit? 6, does the Bible say anything regarding mental health and how to maintain it? And 7, can we pray away mental health problems? 8, how does your faith influence your work in the mental health field? 9, does struggling with mental health issue mean you are a bad Christian? 10, why do you think there has been a prominent rise in the mental health issues in the last decade? And 11, do you believe the church's stance on mental health can be dismissive? 12, how as Christians can we encourage loved ones or friends struggling with mental health issues? Now, what is mental health? Basically, it refers to our emotional, psychological, and social well-being. We all have mental health, just like we have physical health. Our mental health affects how we think, feel, and act. It also impacts on how we cope, interact, and form relationships with others, as well as our daily functioning. Mental health refers to our emotional and psychological well-being, and it's influenced by our life experiences. This is very important. Mental illness encompasses a wide range of disorders, often caused by genes or brain chemistry. This includes mood disorders, personality disorders, eating disorders, and much more. Each mental illness has different symptoms and can impact an individual's life differently. Mental illnesses are recognizable conditions that can be professionally diagnosed and treated. So let's make the distinction between mental health and mental illness, and also between physical health and physical illness. The two are not the same. Now, an individual may have low mental health, but no signs of mental illness. For example, someone may be going through a very difficult breakup and struggling with their job as a result. This could lead to feelings of low mental health, but this doesn't mean they are automatically going to suffer from mental illness. Similarly, someone may have a diagnosed mental illness, such as bipolar or OCD, obsessive compulsive disorder, but is able to manage this effectively and lead a healthy and satisfying life. In this scenario, the individual may have a mental illness, may have a mental illness, but have good mental health. While low mental health can sometimes be overcome through practicing self-care techniques, example, mental illness cannot. On the other hand, mental illnesses are caused by biological factors and chemicals in the brain, and these can be changed merely by willpower. That's not to say other well-being practices cannot be helpful and aid recovery, though mental illnesses can also be treated through medication and talking therapy, among others. Now, the question is, how as Christians can we encourage loved ones or friends struggling with mental health issues? Lack of medical diagnosis should in no way undermine the devastating impact of low mental health. An individual should never be told to get over it or be pushed to cheer up if they are suffering from mental health problems. They should be guided to set their own pace and find the right coping mechanisms to suit them, including finding professional help. Both mental health and mental illness can be stigmatized. People are tentative when discussing mental health because others often take this to mean mental illness. But even if this is the case, why should mental illness automatically have negative connotations? This is a personal question. Mental health and mental illness are often associated with negative stereotypes. Sometimes individuals with certain conditions are portrayed as dangerous, criminal, or unable to lead normal and fulfilling lives. These negative stereotypes lead to many people with a problem feeling unable to seek the help they need. Even small examples of stigma, such as the everyday use of words such as crazy, leads to negative connotations. As a society, we must overcome these stigmas and educate ourselves. Understanding mental health and different mental illnesses is the first step to be able to help our friends, colleagues, and members of the community. And this can also start in the church. The Bible and mental health. Some of the common ailments associated with mental health are anxiety and depression. According to the Anxiety and Depression Association of America, 264 million people struggle with depression and 40 million people struggle with anxiety. It's a true reality that anybody can struggle with their mental health, whether the individual is young or old, a believer or unbeliever. If you struggle with mental health, you are not alone. Other mental health problems in addition to anxiety and depression include eating disorders, personality disorders, psychotic disorders, and PTSD, that's post-traumatic stress disorder. Each of these illnesses can happen to a person for a variety of reasons. Thus, it is crucial as believers that we do not judge, belittle, or condemn those struggling with mental illnesses. Rather than condemning those with mental illness, Christians are to help show kindness and love them, as in John chapter 13, verse 34 to 35, which you can refer to. Now, the body and the mind. The individual's body and mind are both factors of a person's mental health. If a person's mind and body are having difficulties, a person's mental state will suffer as well. Elijah was a prophet who struggled with suicidal thoughts during a difficult time in his life. 1 Kings chapter 19 verse 4 informs us of Elijah's struggle. While he himself went a day's journey into the wilderness, he came to a broom bush, sat down under it, and prayed that he might die. I have had enough, Lord, he said. Take my life. I am no better than my ancestors. This is Elijah. What did God do? God did not take Elijah's life, but rather gave him the strength to keep going. God helped Elijah by providing Elijah with a good nap and a good meal. 1 Kings chapter 19, verses 5 to 8. After Elijah had slept and ate, he was ready to continue on with the work of the Lord. While those who struggle with suicidal thoughts may not feel better after taking a nap or eating a good meal, God does not want any person to take their life. And if a Christian is struggling with suicidal thoughts, they need to seek out medical help, therapy, and most importantly, pray to God about their feelings. And there's nothing wrong with seeking help from doctors. So prayer should follow with action. Seek help from doctors, therapists, or counselors. And God has placed such professionals, doctors, therapists, and counselors in their positions for a reason. And we know that in the Bible, St. Luke was a physician. Now, there are some key scriptures in mental health, which I would like to mention even in this key scriptures relating to mental health. These scriptures do not take the place of professional counseling. If you are struggling with your mental health, please reach out